Hello, everyone, and welcome to this special discussion about the best ways for people to manage their health, reduce medication errors and medication misuse, and use technology as a tool to make everyone healthier. My name is Nisha Charya, and I'm a contributor to Forbes magazine, and I'll be your moderator today. Joining me is Kim Shah, who's the CEO of KnowYourMeds, a groundbreaking app that uses artificial intelligence to help people manage their medications, prevent medication errors, and provide insights on an overall healthier lifestyle. And we're very pleased to welcome Ms. Camille Schrier, who is the reigning Miss America. In 2018, Camille graduated with honors from Virginia Tech with a dual Bachelor of Science degrees in biochemistry and systems biology, and is currently pursuing a doctorate of pharmacy at Virginia Commonwealth University. Whatever your perceptions of Miss America might be, Camille, you have taught us to throw it all out. In June of 2019, Camille was named Miss Virginia after breaking from tradition to perform the catalytic decomposition of hydrogen peroxide as her onstage talent. Over the last year, she's used the Miss America national platform to promote her own social impact initiative, Mind Your Meds, drug safety and abuse prevention from pediatrics to geriatrics. And so you can see why we're having her here for this conversation. She's also been an advocate for STEM education and for more women to follow careers in science and engineering. Camille, it's great to see you again, and thank you so much for joining us. I'd love for you to start by telling us about your experiences as Miss America in 2020, especially in the time of COVID-19 and what you've seen as you've traveled the country and advocated for your causes.
Hi, Nish. Thank you so much. It has been a weird year, to put it lightly. When I first won Miss America in December of 2019, I had no idea that I was going to be the first Miss America to serve during a pandemic. So that has been an interesting experience. I did get 2 months of being able to do hands-on, in-person events, which, as Miss America, I'm often at large events with many people shaking hands, and that's not really conducive to keeping the spread down of COVID-19. So I've now transitioned. And so the one thing that was really important throughout this whole process for me was being able to continue my messages of STEM education for kids and really for all people, because I'm a science nerd, but also continuing my Mind Your Meds initiative and talking about prescription drug abuse, talking about medication safety and how we can combat the opioid epidemic. So I've been able to transition that online, which has been great because I can now literally be in many places at once virtually, rather than just being with a group in person, which is effective. But I think having more long-standing content that's going to be able to educate a lot of people across the country is honestly just as valuable, if not more valuable. So I'm trying to see the positives in what I've been given this year. And I feel like I've been effective in getting my message out. And so I'm really grateful. It's been almost a whole year since I won, this week, actually. So looking back, and I'm really grateful for the opportunities that I've had this year.
That's amazing. And you could have worked on any topic you wanted to. And obviously, it's been a crazy year, COVID, racial unrest, economic problems. But you picked this one about substance abuse, medication usage, which is very important, no doubt. But how did you come to that? And why are you so passionate about it?
Yeah, when I was starting to compete in the Miss America organization, which was early 2019, I was kind of charged with picking a social cause that I wanted to advocate for. And that's one of the really cool things about Miss America. You mentioned before that I've kind of thrown out everything about what Miss America was, which is so true. But I will say the one thing that really, really drew me to the organization always was that every girl gets this opportunity to advocate for something that's important to her. So it kind of, gave me the chance to think about what's important to me. And as a pharmacy student, I started to see how much medication errors could affect families and kids. Now, my mom was a nurse growing up. So when I got medicines, they were in a syringe drawn out, like measured. She was making sure that, she knew what time I was getting everything that you were supposed to do correctly. But when I got into pharmacy school and I started learning how to counsel my patients, which were really my other students, and I had to give the directions on how to give that medication properly. And I was trying to remember everything. And I'm thinking, if you're a parent and you have a sick child, multiple sick children, how easy is it to make a mistake in that? And the answer is it's very easy to make a mistake, even when you're giving yourself medication. So I thought, this is an important issue, but then even going a little bit further into where prescription medications can be dangerous, we think of something like the opioid epidemic, that's something that really transcends from the prescription to potentially illicit substances. And so I decided to call it Mind Your Meds, which kind of scooped up all of those different pieces into one, talking about medication safety and then also talking about substance abuse and prevention of substance use disorders. And so I do a lot of things with Mind Your Meds, but I'm really grateful that I chose it. The other thing, the reason why this was really important was, as Miss America and formerly as Miss Virginia, I wanted my initiative to be relevant to every single person that I met through the process, whether or not I was at a event that you wouldn't even think anything would be relevant in terms of a social cause, like a fashion show, right? Everyone there likely has taken a medication at some point in their life or has given a medication to someone. So it gives me the opportunity to continue to talk about this in a way that is relevant to every person that I meet, and hopefully I can make a difference. And so that is part of why I chose it. So for many reasons, but the more that I talk about this, the more I realize how important it really is. And so I'm grateful to have the opportunity to be an advocate for this cause.
That's great. And as you think about year two, you spent year one obviously building out the knowledge, building out the idea of what you're working on. But now you get to really act on it. You get this unprecedented opportunity to be Miss America for 2 years in a row. And so, how are you thinking about year two in terms of partnerships? What can you do with groups like Know Your Meds or the substance abuse clinics you've been working with? So, how are you thinking about this amazing opportunity in year two?
Year two is going to be, I think, pretty different than year one. I'm going to be heading back to school, number one. And so just in terms of Know Your Meds, I'm going back into my pharmacy education in the second half of 2021. And I will be a very different pharmacy student, number one, going into that experience because of what I've learned this year, but then also thinking about tools like Know Your Meds and how that really well relates to what I do in terms of medication safety and being able to help educate my fellow students on some of the issues and ways that we can combat these and ways that we can mitigate risks for our patients and giving them the tools that they can use. I think that that's probably one of the most valuable things that I've learned this year is understanding where people have issues, really hearing the problems and experiences that other people have had, whether or not it was substance use disorders, getting addicted to prescription medications, or any of those types of things. Moms who have given their children medications improperly. Just understanding those things, I can be a better advocate for patients, even with my peers. So that will be one of the biggest differences that 2021 will look like. But I'm grateful that I'm going to be able to continue my advocacy. And that's something that I think is going to continue even far past whenever my time as Miss America comes to a close, because it's so related to my career path. And so I'm grateful that I can combine my passion with my work. And I think that that's going to really help me through my career as well.
Yeah, and let's hope that by at least next summer or so, you'll be able to do some events because obviously doing things in person makes such a difference compared to Zoom, and hopefully you'll be able to get out there and share the message. So I wanted, sorry, go ahead.
I am hopeful for that.
Yes, I think we all are. Kim, I want to bring you in on this and talk a little bit about the role of digital health in this. You lead a very innovative organization, Know Your Meds. You've been at the leading edge of looking at mobile technology with the app, telemedicine, and artificial intelligence to help people to know their meds or to mind their meds. And so as you think about what you're trying to build and the impact you're trying to have, tell us a little bit about the vision behind Know Your Meds and what you're doing.
Sure. Thank you, Nish, and thank you once again to Camille. Just a quick aside, last year when Camille won Miss America, I naively went to her Facebook page and requested a conversation with her, hoping that she would respond when I saw her Mind Your Meds initiative and with our Know Your Meds business. Needless to say, I was one of many thousands of people who probably reached out to her at the time. So Camille didn't get a chance to respond back to me. But I'm so happy that we finally connected this year. We started Know Your Meds back in 2017, really sort of recognizing two things. One, that people are really quite bad when it comes to managing their health and all aspects of it. The first one being just being more informed and aware of what is going on with them, whether they have one or more diseases. But then beyond that, why are they given certain medications? Why is it important to follow their doctor's instructions to take those medications, refilling their prescriptions? Why is it important to keep a track of their health as they take in these medications? Because the dosage might be wrong, or the particular medication might be not appropriate for them, and so on. Beyond all that, I often have this fond way of saying that people don't get up in the morning thinking, today I'm going to be bad. I'm not going to take my meds. I'm not going to be healthy. But at the end of the day, they do end up being bad by not doing what they're supposed to have done. And our feeling is that digital technologies, if they come across to a person as being highly personal, highly timely, and relevant, more likely then that the individual will behave in a healthy way, right? As opposed to not. And so now with Fitbits, smartwatches, blood sugar or blood glucose measuring equipment that's attached to your body, just all kinds of wonderful technologies that are coming out make it a lot easier to keep a track of these things, to be reminded of when to do the right thing. And where AI comes in is in this element of making it highly personal, right? Because it's otherwise, we all get little pieces of paper when we pick up medication from the pharmacy, but nobody reads that because nobody believes it applies to them, right? And that's the difference, I think, with the technologies. So that's why we're so excited at being able to bring this to people all over the world with a very simple goal: just get them to be more informed and have healthier outcomes.
So Kim, I have 5 medications in front of me that I'm taking at this moment. Tell me, does the app read them all? Does the app, do I have to put it in separately? Like, how does it make life easier for me to understand the impact of this?
So basically, yes, you have to enter the medications yourself. The app doesn't read, so quote unquote, read them. It's a one-time exercise, or as you get new medications, you update your app. What the app does is, beyond sort of just reminding you when to take your medications, it also gives you warnings if 2 or more of your drugs have the same ingredient, for example, or if 2 or more of your drugs are contraindicated with each other, or if there's an FDA warning on your particular drug, there might have been a recall or something. So all of those kind of timely warnings come to you, and also, of course, things like food, what to watch out for, alcohol, and so on. So almost anything to do with your disease and your medication that you need to be aware of at the time you're taking the medication is really what it's about.
So Camille, turning it back to you, you've been Miss America for a year. You've communicated with so many people about this initiative of yours. Kim has been talking a little bit about Know Your Meds and the role of the app. What have you seen in terms of 2 things? One is innovative technologies people are using, maybe developing themselves, and actually approaches that people are trying to get through to patients better, to take better care, to track their medications, all these things. So, what have you seen around the country where you said, that's really interesting. I hope more people might do that?
I think the biggest thing that I've seen, and I definitely echo Kim in this, is that people are really bad at managing their medications, and people really struggle with understanding how and when and why to take their medications. So I think number one, tools, whether or not it's digital tools or even something as simple as having one of those pill boxes that has the days of the week on it, any little thing that we can do to make it a little bit easier for patients to understand and be better advocates for their own health, I think is so incredibly important. And I frankly haven't seen a lot of really great innovative solutions to a lot of these problems that go beyond, a simple medication log or having those divided up pill boxes. Those are the things that I talk about often. But having something that can actually remind you to do an action. I know I'm very reliant upon my cell phone and my calendars and my reminders because we all live this very busy, technology-driven life now. So I think that having something like an app is a really interesting and smart solution to that can be coupled with things that are those traditional technologies like those medication organizers and logs. I, of course, think of things from an overdose perspective often because people, especially with some medications that can be very dangerous, if people don't take them correctly, they can end up in a really dangerous situation. And Kim, you talked about that as well. And with medicines that have the same active ingredient, if you're taking those together and you're not aware, you can really damage your body and end up in a very dangerous situation. So I've seen a lot of people across this country who don't mind their meds. And that's one of the things that I'm trying to find solutions to, of how to make that easier for people, especially for people that don't have medical training or a medical background and frankly don't know a lot about healthcare or their medicines, to make that really easy for them so that they can be as safe as possible.
In your training, you're getting a doctorate in this. Are you seeing new tools come into how pharmacists are trained, pharmacologists are trained that are interesting as well?
Well, I'm only 1 year into my 4-year program, so I have to be really, really honest with you.
Right.
But one of the biggest things that I've learned through pharmacy is the power of counseling your patients and taking the extra minute to ensure understanding, and not just telling your patient what to do with their medication, but having them repeat it back to you so that you can ensure that they know that I'm taking one of these every 4 hours, with food, whatever the directions for that are. You spoke about people taking that maybe the paper out of their prescription and just assuming that they don't need to read it. Oftentimes people don't even read the directions on their medication and take it properly. So as pharmacists, we have a really, really unique job to be able to directly interact with that patient and keep them safe, and just to get to know them as well as people. That's one of the great things about pharmacy. We're one of the most accessible healthcare providers. So that's been something that I've really learned in my first year, but I'm sure that I have a lot more to learn in the coming 3 years that I have left.
Well, and it's amazing with the COVID-19 vaccine. I think the pharmacist will be, the most contacted person as everybody goes into the pharmacy and asks questions. So I think you're absolutely right about that. I want to broaden the conversation a little bit to health outcomes in general, beyond just medication errors and knowing your meds and minding your meds. I guess let's start with you, Camille. How do we get people to understand, that taking their medication is not the whole answer, that they need to be more aware of the diseases they have, the treatments that they've been prescribed, and that they should keep track of their vital signs for themselves, for their physicians? So how do we just broaden the society's, knowledge of why this is important, beyond the 1 week or so, or, months or days that they've been prescribed something, at least in their mind?
That's a huge issue, I think, in so many pieces of our society, that there's a real lack of caring for our health. Despite the fact that we probably see hundreds of health-related ads on television or online every day, people are not at their deep core always focused on their health. So many of us, maybe it's a temporary thing, or we get on a health kick and then we completely don't care about it anymore for a long time. I think talking to people about the long-term benefits is the biggest way that we can help to change behaviors. I think I'm a huge advocate for preventative medicine, number one, and whether or not it's monitoring for someone maybe like a diabetic patient, someone who can monitor their blood glucose and prevent themselves from having to be on another medication or take a different insulin or take more, just taking those steps to prevent needing medications. And that is an interesting point in pharmacy, because people assume that pharmacists just want to give people medications. In reality, I want to get my patients off of a lot of their medications through healthy living and healthy lifestyle. We're in a society, unfortunately, where we see a lot of we rely on substances and medications and sometimes other vices in our life to get us through things. And we just say, oh, we can just take this pill and it'll make us feel better. But in reality, if we changed our lifestyle, we could really benefit ourselves in so many ways. And I think that that goes beyond just safety with medications. It's a societal thing. So I think that really having a different shift in a mindset to be why it's important to be healthy and how that can benefit us long term, whether or not it's financially or really just giving us a longer, healthier life, can go a long way. And I think that that comes with a lot of education. And to that point, when we think about even underserved communities in this country who don't always have the access to resources and education on how to keep themselves healthy, maybe they don't have access to places to exercise well or foods to eat that are nutritious. There's so many people in this country who don't have those resources. That's a number one thing that we have to change too. So it's a very complex issue, as most things are nowadays. But there's so many things that we can do to really improve that.
Great, thanks for that. I agree with you. And I think in your role as advocate, in your platform as Miss America, you can play that role of advocating for important things people need to think about in their own health. And obviously you have the credibility in terms of your own academic career that goes with that. And so I think it brings credibility and millions of followers on social media who can then amplify that message. And so that's really wonderful. And so Kim, sort of turning to Know Your Meds, there's two parts to behavior change. There's what Camille just talked about, the platform, the education, the shouting from the hilltops. And then there's the role of a technology, the thing in your hand. And so when you think about outcomes, why was that so important beyond just the medication tracking and the adverse events? How did you think about outcomes? What tools did you guys build into the app to address that?
Once again, thank you, Nish. So we approached this kind of in a three-part way. We said once somebody's diagnosed with, especially a chronic condition, the medication is element one, which is one or more meds that you take to hopefully alleviate or mitigate whatever the condition is. The second part then is medication not being enough is you have to either reduce your weight or keep your blood sugar under control or keep your temperature or whatever it is that you're supposed to monitor. A, because it may be an indication of whether the medication is working or not, or B, it's simply sort of a way of, as Camille was saying, to actually get you off the medication in some ways, right? If you behave properly. So that was the second part. But then there was a third element, which is depending upon your age, your gender, and your disease conditions, there are various screening tests and vaccines and things like that. So, mammograms, colonoscopies, annual eye tests, and annual physical, all of those also enter the picture, right? And if you think about it, the guidance used to be, for example, for men, at the age of 50, you should get your first colonoscopy. And based on the result of that, your doctor will tell you when you should do the next one, whether it's 5 years or 10 years or whatever. Well, it's important that you do that next one, even though it's X years away, right? And I don't know how many people actually diligently remember to do what they were supposed to have done when they were supposed to have done it. All right, so that's a problem. It's astounding to me that 1/3 of adult Americans in the age group of 50 to 75 have not had a colonoscopy. Just boggles. I mean, it's such an amazing that the colonoscopy. I mean, colon cancer is like the second or third leading cause of cancer deaths in this country, and colonoscopies are so useful in either curing you of that or maybe not letting you go into that in the first place, and yet they don't do it. And I've got to believe that a lot of it is just simply not being aware at the time and then not doing it, right? I mean, there may be other reasons like affordability and so on, but putting that aside, there's no reason why not. So the tool really has all this built in. It sort of takes you as an individual, and by the way, this is all HIPAA compliant, so your privacy is very important. And once you put in your drugs, the tool sort of imputes that you're living with one or more disease conditions, confirms that, and then populates the app with all this information. So Every morning, you literally like a Outlook calendar message. The app sends you a message in the morning saying, today, these are the medications you're supposed to take. These are the vitals you should track today and record, and anything else that might be happening. And oh, by the way, you may have an appointment coming up in a month's time for your eye test. Make the appointment, get it done, right? And that kind of thing. Clearly, we can't force people to do anything, right? I mean, it's a free society. All we can do is hope that a nudging and a reminder and informed patient, makes for a healthier patient. And so that's really the role of the app. And we made it a free app because we didn't even want the cost of the app to be a barrier to somebody downloading and using it. So it's available on the iPhone as well as Android devices, and anybody anywhere in the world can download and start using it.
That's amazing. And I know you've had some great traction in the United States, but also Mexico, India, and elsewhere. And so I think the fact that science is a common language makes it easier for people to use everywhere around the world, and the trust in the US FDA and our standards. And so that's very exciting. I want to transition to our last topic of this conversation, which is this use of digital tools as aids, and particularly with COVID-19. How are we thinking about tracking and getting people to use the vaccine and all of those sorts of things? So Camille, I'll start with you. We're speaking on December 14th, 2020, the first day that Americans will be receiving the COVID-19 vaccine. I think we're all excited and relieved to have made it to today. What are your thoughts about the vaccine, and how do you think we make sure all Americans get it, have access to it, take it?
Well, goodness, if I could answer that question, I would be the US Surgeon General. But I think that, number one, it's really impressive that we've come up with a vaccine, 2 really approved vaccines this quickly. When we look back in history and we look at vaccine development, this is really groundbreaking. So number one, I'm just impressed by the companies and the institutions that have come up with this so quickly. But of course, the distribution and the production and the logistics of getting this into Americans is a whole other piece of this. There's some barriers when we think about people who don't trust the vaccine right now. I've heard a lot of that. But also access for those in underserved communities. Again, I think a lot of my time as Miss Virginia really opened my eyes to underserved communities in really rural areas, but that's also where pharmacists can be really helpful, because sometimes that's the only healthcare facility in certain towns is a pharmacy where then people can get the vaccine. But first of all, going back to education, why is it important to get this vaccine? Especially unlike, medications where you're taking it to either cure or prevent a certain ailment. Vaccines for some people are like, well, why would I do that? Like, I don't need to do it. Everyone else will get it, so then I won't get the disease. But it's important to understand how something like herd immunity might work to be able to keep us safe from COVID. So that's another piece of it. But I think that it's important that we use, I've heard that we're going to use a lot of the mail services, UPS, USPS, and the Army logistics to get this out to people. But I think it's so important that we talk to people about the importance of vaccines. I know as a healthcare student, I'm going to have to get the vaccine. And Kim, I think you were talking about how do we, prove that we've gotten it? When do we get tested? Those types of things. When I went into pharmacy school, I had to provide proof of all of my vaccinations. I had to get titers taken from my blood because I was going to be working in the hospital. So that's something that I think is going to continue with this vaccine as well. But I'm really, really excited to see this come out. Additionally, when we think about the COVID vaccine, particularly, it's a 2-dose vaccine. It's a whole other issue when we think about, number one, getting the first dose, remembering to get the second dose in the proper amount of time, and then having the supply there for the pharmacies, the hospitals, whoever is administering that, so that that person can get the second dose on time. That is also where something like a digital reminder could come in to help people, or even just simply putting it on your calendar. Once you know, okay, this is the day that I need to go back and get the second vaccine. That's going to be really effective in really getting the protection for people who are getting it, and keeping the idea of, getting the vaccine at all, making sure that it's really effective for those patients.
And, with your platform, unfortunately, there are vaccine skeptics in America. There's rich, there's poor, urban, rural. Unfortunately, there's pockets of resistance everywhere. And given the politics of today, it seems to be much more so for COVID than for measles and other things. And so have you thought about your platform and the fact that everybody watches Miss America, to sort of build confidence in the vaccine and build confidence in people listening to their pharmacist and their doctor and those experts that are out there?
I think that, I haven't really thought about that, but I'm definitely going to have to get the vaccine to go back into the hospital.
Right.
It'd be something that I would think about, but I want people to educate themselves and talk to their healthcare providers and make that decision for themselves. I don't think, especially not as a licensed healthcare professional myself yet, I don't think that it's my place to tell people what to do in terms of their health yet. I can make a suggestion and kind of use my platform in showing that I'm making a certain decision, but I never want to make people feel like I'm telling them to do something with their own health. I think that everyone has their own right to choose that. But I definitely will advocate for people going to their providers, talking to them, because I'm sure that their healthcare provider will have the same information that I do and be able to help convince their patients that it's the right decision for them.
And Kim, asking you a similar question, you'd mentioned that there might be side effects that we don't know about yet because we move so fast on this. And so how have you been thinking about COVID-19, the vaccinations that are coming along, and what's the role KnowYourMeds can play in education in that space?
So what's happened, in fact, with the arrival of the vaccine, we've been talking to a number of large companies, which have tens of thousands of employees, and many of them can be in kind of different locations, different customer-facing situations, and so on. And obviously, they all have this issue in a big way now, right? Regardless of whether the federal guidelines say one thing or the state guidelines say something else, employers are going to have to be making these decisions too, right? Which of their employees should get vaccinated first, which one second, because they may have totally different criteria for deciding. So that's point number one. Secondly, there's a lot of conversation about whether they'll be able to mandate vaccines, right? So if you're a hotel, check-in person or a cruise ship employee or whatever, will your employer be able to say to you, you have to get vaccinated because we can't take the risk of you, passing the infection to some customer of ours who will then turn around and sue us? So that's a societal issue. That's not something that KnowYourMeds is going to solve, but it's certainly, I can understand how employers are worried about this. And then beyond that, if for valid reasons like religious reasons or otherwise, an employee gets an exemption from being vaccinated, well, now the employer is going to have to decide what to do with this employee, right? Can they reassign them to a non-customer facing situation, for example? Or can they say that there's some other regimen that you have to follow, like you have to be tested every other day, or, I'm not quite sure what. And I think large employers are also asking the same questions. So this goes beyond even what Camille just talked about, which is simply being reminded, which is important enough, right? That you've taken dose 1 and you should take dose 2. And by the way, don't mix them, right? So if you get Pfizer's dose 1, then your dose 2 has to be Pfizer again, not Moderna, right? Or some other one. So that's something to think about. So all of these kind of things, the app will do very well, right? Your question was also about side effects, Nish. There is no doubt that after the clinical trials were over, so far they've tested maybe 50 or 100,000 people between the various companies. But the reality is overnight, millions of us are going to get this vaccine. And who knows what our previous conditions are. They could be, diabetes or hypertension or whatever. There could be age. And so I think a lot of other side effects and reactions are probably going to come to the fore. And every one of us, society as a whole, as well as pharma companies, healthcare providers, are all going to want to know what's going on. And while the app is not a sort of a fully vetted clinical kind of an application, it certainly will allow us to create a lot of real world evidence around what's going on. So that's how we think that the app will benefit greatly in this sort of next, I would say, 12 to 24 months. I mean, this is going to go on for quite a while, right? It isn't going to be over in a few months.
Right. The last question I want to ask both of you, the same one. The Institute of Medicine in 1999 first brought the issue of medical errors more broadly to the public attention. That it was the third leading cause of death. We're now 20 years later, the awareness is there. We have technology, we have artificial intelligence, we have apps, we have people in high positions like Camille using their platform to talk about this. So do you feel, and maybe Kim, you can go first because you were just speaking about it. Do you think we can solve this problem in our lifetime?
Do you mean in terms of solving the problem, Nish? Do you mean the medication
minimizing, minimizing medical errors?
I think, well, to a certain degree, yes. I mean, to the extent the pharmacists will have this information at hand, obviously, and they'll be counseling the patients, as Camille was saying. That I think pretty much is solved or is going to be solved. The challenge is really the end user, right? So at the end of the day, for example, if I go to a doctor and say, I'm having trouble with this medication, the doctor says to me, okay, well, throw that away and I'm going to give you a new medication. If I now go back home and for whatever reason, don't throw away the first one and somehow get distracted and take both or take, any number of combinations of things I can do wrong, I will do wrong, unfortunately. That problem is not a technology problem, right? I mean, if you don't do what you're supposed to do, then you're kind of stuck with it, right? And society is stuck with that. So there are those kind of issues. I think the kind of issues we can solve and we will solve are certainly the things like ingredient, medications, the same ingredient, contraindications, those kind of things. I think technology will be very able to solve. It's at the end of the day, it's still the end user that if they pay attention to applications like ours, then they have a much better chance, hopefully, of not making those mistakes.
Camille, same question to you. What do you hope will happen in your lifetime, far beyond being Miss America, to address this problem?
I hope that people just become a little bit more aware. We do have the awareness there, but I still feel like, especially in my generation, there is a general disrespect for medicines and substances as this like, oh, it's from a doctor, it's safe, like I can't hurt myself with this, or even things that you can get over the counter in a pharmacy. There are still college students that abuse prescription medications to stay up all night to study for exams. And I think if we don't change that culture, we're not going to effectively be able to reduce adverse outcomes with medications like this. So number one is to make people aware of the power of the medications that they're taking. That's something that I do often when I'm speaking with groups. And so I hope that we are able to change that so that people have a little bit more respect for what they're putting in their body. I'm always kind of boggled when people are cognizant of what they're eating, but not really as cognizant of what medicines they're taking or how they're taking them. I think that those two things kind of go hand in hand because you're putting different things in your body that are going to affect the way that you function. So changing that culture is something that's really important. I do think that we're going to get to a place where people will be more aware with apps like KnowYourMeds, but even just through education through pharmacists. And I think that especially when I look at my peers, my friends, just changing that as the generations come through can be really effective. And I'm grateful that I get the opportunity to talk about it every day.
Well, thank you both. We've reached the end of our time. I want to thank you, Camille Schrier and Kim Shah, for an amazing conversation. Camille, you have an amazing platform, and it's very heartening to see the amount of good you're doing in your role as Miss America. I certainly look forward to year 2 of this adventure as you started. And Kim, congratulations on building this amazing technology platform in KnowYourMeds that will hopefully, between the work of both of you, end a leading cause of death and illness in America. So thanks to both of you, and thanks to everybody for listening today.